For all the latest updates, subscribe to News 9.
On Thursday, the Union Health Ministry briefed the media over the COVID-19 situation in the nation. During the briefing, Health Ministry reckoned that the recovery rate had gone up compared to the rate in April. The Health Ministry said the current recovery rate stands at 64.4% against the rate in April, which reportedly stood at 7.85%. During the question and answer session after the briefing, the Health Ministry also briefed about the situation in West Bengal.
West Bengal is one of the states which the Ministry of Health had reviewed with the topmost officials of that state, and subsequently it was also reviewed at higher levels in the union government, and after that review detailed written instructions have been shared with the state government, and we hope that with the collaboration of the state government and with the help that union government is extending to the state based on their request, West Bengal would be in a position to contain the infection and would show results in the coming days.
One of the questions raised focused on MHA's guidelines on Unlock 3. The ministry said SOP for gyms would be issued by the Health Ministry.
In the Unlock 3 guidelines of MHA, among the activities which will be permitted from 5th of August, gym and yoga are activities which will be permitted. We have already started taking technical inputs from domain knowledge experts, and the ministry, that is the Health Ministry, is working on devising these SOPs, and these SOPs will be issued adequately in advance before 5th of August.
Another important question that was raised is whether the vaccine, which will be developed, would be administered to health workers first or the vulnerable population.
You see, this vaccine, whenever it comes, that is the COVID-19 vaccine, would have to be administered on a much larger scale compared to the existing vaccines. So that is something on which there is near unanimity. The questions which are being discussed are questions of logistics. How would it be stored? How cold chains will be maintained? How it would be actually made available to people? How would it be procured? So on and so forth. But there are far more important, or maybe equally important, ethical questions. Who gets it first? So these questions are still under deliberation in the union government.
When asked about the status of COVID-19 vaccine, this is what the ministry had to say.
24 वैक्सीन कैंडिडेट ऐसे हैं जो अभी क्लिनिकल इवैल्यूएशन में हैं पूरे विश्व में. 24 वैक्सीन कैंडिडेट्स are under clinical evaluation in the entire world, and there are 141 vaccine candidates which are in pre-clinical evaluation stage. भारत में 2 indigenously developed vaccine हैं, दोनों phase 1 phase 2 clinical trials उनके प्रारंभ हो गए हैं.
Although the COVID-19 pandemic continues to spread its tentacles across the nation, the only silver lining is the recovery rate, which stands at 64.4%.